explaining the blood and the patterns that I've been seeing in the patients coming in, which prompted me to start to keep records. So on the first slide that the viewers are seeing, this is a patient that came in seeking medical attention before the vaccine. We treated her, and afterwards, this is what her blood looked like. So a couple of months later, she was very happy and feeling much better, and her blood was showing perfect round red blood cells, beautiful neutrophil that is your white blood cell fighting cancer and viruses. And she was just feeling great. And then we didn't see her because she was doing so wonderful. And then after a couple of months, she made another appointment with me. She was insisting on an appointment because she was very short of breath. She wasn't feeling her best. And when she came in and I looked at her blood after the vaccine, so she told me she had the vaccine, and this is what her blood looked like afterwards. So it was quite shocking to see a patient with completely normal, healthy blood come in after a couple of months, and we see this very severe stacked rouleau. So it's a very dangerous form of rouleau. It's not just a normal rouleau where there's no oxygen. These red blood cells cannot function at all. If you would understand that the capillaries and the little arteries are 4 micron in diameter, red blood cells have to actually single file to get into those capillaries. You're talking myocardial problems, intravascular blood clotting. So there's no oxygen that can actually reach the small arteries in the brain and in the heart. So I was very shocked to see this. And she wasn't the only one. I started to see severe these weird structures in patients who had the jab. And again, the red blood cells are so deformed, you can't even, make head or tail of it. I've never seen that before.
So when you're talking about these weird structures, are you referring to these round black disc looking things?
That I didn't see in the blood per se, but I saw black structures in the blood because there's 2 techniques that I use, and that's why you'll see discs in the one technique and you won't really see it in the blood, because we use a cover slip to cover the blood. So it basically presses down the sample, where when I looked at the vials, I used a different technique, and I will explain that briefly when we get there. So I started to see these very strange structures, which I won't explain. Again, just the rouleau, I thought they were just crystals, uric acid crystals, but they did not resemble it completely. And I found this in every single vaccinated person with symptoms. And then I was so startled, yeah. So in this picture, we could see these black matter, and I found that in every single patient who had the vaccine. This was done at a 400 times magnification, and the next one is also, this was done at a higher magnification. I think this was about a 1,600 magnification. And then the lawyer approached me, like you mentioned, and she brought me a vial, because I don't do that type of injections with my patients. And when I looked at the vial, I was so shocked, because what I was finding in my patient's blood, I actually saw in the vial as well. And here on the next picture, I mean, if you can, compare the two, you can see it's exactly the same structure. So that I found in the vial. And this I also used by covering it with a cover slip. So it's basically, a normal slide, your microscope slides, and then I just covered it with a tiny cover slip. So this is how I got these images. And just for other scientists and doctors maybe watching, this is probably the technique that they use, because this is how we get taught. Just to mention that I'm not a particle expert at all. I'm not a biochemist. I don't know what I'm looking at. I'm just reporting what I'm seeing.
Well, we would definitely it would be advantageous if somebody would come forward who has that expertise. But what you're seeing here, appears to be this round black disc with metal connectors. So what kind of feedback have you gotten from other experts with whom you have shared this?
So a lot of the other structures that I've been showing was done by using this technique. And when I shared it with a couple of other experts, I think because I haven't used this technique, they are not kind of seeing this. But yeah, nobody has really come out forward and saying, yes, this is what it is. Everybody agrees that it's not natural. It's too structured to be anything biological. So I think that's the consensus. But I have not gotten, a 100%. Nobody's really come out and said, yes, this is what it is. There's some speculation, but I don't like to speculate at all. But these were self-assembling. I have a video of it, which I didn't share now with your viewers, but they were self-assembling, which was very strange. And so I did one at a lower magnification, and then I did one at a higher magnification. And now we're looking at the discs. And really, if anyone can explain what this is, and this I did by not covering the vial. I actually just put a droplet and I put it under my microscope without covering it. And I think that's when maybe other people will start to see these type of structures as well. People doing microscopy will maybe be able to also see these same things.
So this is just one droplet from the vial. You're seeing all of this stuff. And you said that you don't think that these look biologic, but that they look more engineered. Can you say more about that? What do you mean by that?
Well, I mean, they're very symmetrical, and they seem to be joined together by, I can just say what I'm seeing.
Right.
I'm not sure what to make of it. If anybody has seen this before, then I would also like to know what it is. But I did about 4 samples, and I saw this in each and every sample. I took it from the same vial, but I checked it 4 times. And then when these black structures, when the sample dried, and this is another technique, is I just left the sample on the slide and it just dried. And then I came back and I looked at it, and then these disc-like structures have they're gone. You can't find them anymore. But these black lines started to form. So that's the next thing I saw. And again, Stu, I wish I could tell you what it is, but I'm not a specialist in molecules or in particles. But
you've been examining live and dry blood for an extended period of time. How long have you been doing this?
15 years.
And in the 15 years that you have been doing this, have you ever seen anything like this?
Nothing.
And the only thing consistent about the blood that you are seeing these structures in is that these are patients who have received these shots being called COVID vaccines.
Yes.
Okay.
Yeah.
Let me ask you this. Is it possible that these are air bubbles?
So I actually had a discussion because I wanted to find out what it is. So I went and I looked at some air bubble structures, which were that looked similar, but most of the doctors that came back to me said, they are too symmetrical to just be air bubbles. They're very symmetrical. They're so uniform. But Stu, I wish I could really put a stamp on it and tell you what it is, but I'm not sure.
Okay,
I'm not sure what it is.
Doctors that have examined or looked at your findings have said, no, these are too symmetrical, which would substantiate what you had already said, that these appear to be engineered, whatever this thing is, these black discs with some sort of a metal-looking connector is what I think I'm looking at here. I mean, does that appear to be metal to you? I mean, I don't know. You tell me.
Well, when I did the dark field, these particles did reflect. So I'm not sure what to make of it because they are reflective, and I can just in layman's terms say they look engineered to me. If I'm not sure.
You've seen air bubbles before. And
in the blood analysis, yeah.
And these air bubbles are typically not held together by metal connectors or things that shine, I would imagine. Yeah. Which is what we're seeing here. So what kinds of illnesses are people suffering from that these very strange structures appear in their blood, in their bodies?
I see severe thrombosis, severe embolisms and water retention, cognitive issues, lots of cognitive issues, everything from memory loss to depression. I see patients with blood clots confirmed by an ultrasound, just lots of pain at the injection site, loss of movement from that arm that it was injected, severe headaches lasting longer than 8 weeks, and lots of mobility and pain, nerve pain. People have been experiencing shortness of breath, but then when I look at the bloods, I understand why there is shortness of breath, because the red blood cells cannot transport oxygen when they look like that. And even when I put the oximeter on to test their oxygen saturation, it's low, it's at 89. I mean, so it's not just looking at the blood, there's a physical manifestation of the symptoms.
So these people have low oxygen.
Very well, there's low oxygen, there is blood clotting, there's red blood cell aggregation, there's non-viable white blood cells, so the immunity cannot respond the way it should to viruses and bacteria and infections.
Which might explain these breakthrough cases or this Delta variant, where all of these COVID patients seem to be those who are, quote, fully vaccinated. No, they're injured by these shots is what they are.
I do agree with that. I would like to, maybe if you can just show the viewers, these black structures are not the only structures that I saw. When the sample dried and I looked at it again, I found these strange square-like discs as well, and they were definitely reflective, and they had a very specific structure. So I was, you know, like Dr. Kerry Madej, when I watched her interview and she said, you know, I cry, I do the same. You know, I cry when I see these things. I cry when I see these patients. Just today, I was just seeing patients who had, you know, vaccine injury. They're being told it's not from that, and they're planning to take their children for the vaccine. And I just do my utmost best. Say, please, you know, please don't take your children for this, because I see those patients. I'm not removed. I'm not a scientist that's just reporting. I've got to deal with these patients that are being ignored. They're not getting medical help the way they should. They're being told they got a placebo effect. I mean, I'm seeing a patient tomorrow. He had 8 heart attacks in 5 hours after he was chosen to be one of the you know, the rollout vaccine kind of guinea pigs. And I mean, he's been in hospital since March. He couldn't get he had to have a triple bypass. He couldn't go in because he was testing positive for COVID all the time. He spent months in ICU, and he's coming to me tomorrow because he's not feeling well. He's still fighting for his life, and I hope I can help him.